I'll try to talk loud. So what I am, I'm a licensed professional counselor, and I'm licensed in California and Arizona. So that dual licensure is really nice if you're ever from California or you want to consider going to a different state. Every state has different requirements, so that's something you can pick my brain about. Super important to know about before you get into the field. Also recently just started adjuncting, so that's another really cool avenue you can take. Just a little bit about me. So I went to undergrad at ASU, not GCU, unfortunately. But I went to graduate school in San Diego State University, where I got my master's in early childhood clinical mental health. There we did an early childhood clinic where I also did a lot of research with them. From then I went to clinical internship, clinical hours. I specialize in neurodivergency. So if you don't know what neurodivergency is, that's autism, ADHD. I work with children, adults, families, the whole shebang. So I'm going to give you a little bio of me, but also what it looked like to get to where I am today, advice that I would give, not clinical advice, disclaimer, what it would look like, what are some benefits, and then I'm going to open it up for questions, because personally, I think that's the best way to interact with you guys. If you're interested in the career, what you want to learn about, what you're passionate about, and I'll talk a little bit about working with trauma and what that's like in my life, why I love what I do, and how that is a good way to give back and serve the community. I'm going to use my reference points over here. You can't see the picture, but I have a dog named Fitzgerald. He's like my child, but you can't see him, but he's very cute. And part of that, my dog is like my come home to relax with, kind of recharge from the day. So that's why it'll come in later. Some of the talking points too. So what is the most rewarding part about my job as a licensed counselor? So if you don't know what that looks like, I work in a private practice. So I work with another colleague of mine. We both have our own office. We see clients every day, 8 to 9, sometimes 8 p.m., not always. So that's after I teach or before I teach or in between. What that looks like is I have clients from age 3 to age 74, 75. Not everyone likes to do that wide range, but I personally think it's great. You can develop. What it takes to be licensed. So you have to have your bachelor's, you have to then go to your master's. Most master's programs are 2 to 3 years long. Once you get your master's, then you have 3,000 hours, depending on the state that you're in, of clinical experience. So that's after you've got your master's, then you have to practice outside of internships for 3,000 hours, which does anyone know how long that's about year-wise? If you had to guess how many years that takes. Anyone? No one? Sophia? Just kidding, I'm not gonna call it. 2 years, yeah, you're right. It takes about 2 to 3 years, depending on how frequently you get your hours, how easy it is, what counts, things like that. Once you get your hours, you then have to take a placement exam, a licensing exam, and then you're pretty much good to go, and then you're licensed. So that's kind of the process. Any questions so far that you guys are curious about? Yeah.
Are the clinical hours paid?
Ooh, good question. Not always. So what you do during your master's, you can get paid internships that can count towards your hours, depending on the program. After your master's, they are paid. It's like a associate level clinician. So in Arizona, what it looks like is you're an associate counselor versus a professional counselor. So that means that you're supervised, someone with like a licensure, make sure you meet with them weekly. They help you with any questions, any hard cases. They supervise to make sure you're doing okay. And that typically, yes, is a paid position. Now, is the pay very high? Couldn't say so, but once you get that licensure for independent licensure, it does go up. As we know, counseling and behavioral health isn't for the faint of heart in terms of pay brackets. However, if you decide to pursue like a clinical doctorate or your PhD, that does allow for an increase in pay bracket. It also does mean more schooling and more research. So if you're interested in more research, those have more opportunities. Clinical doctorate is cool for the society, but it does take about 8 years. So that's a cool option, and the main difference between a clinical psychologist and a counselor, because I'm sure you're wondering, is they have a lot of extensive experience in testing. So they do a lot more formal evaluations, they do a lot of psychiatric testing. psychological evaluations. Versus you can do testing as a counselor that you're qualified for, but certain tests require certain levels of doctorate degrees. So that's what they focus a lot on. IQ tests, the MMPI, if you know what that is, it's a personality test, things like that. Any other questions so far? Yeah.
Do you ever have to like renew that certification that you get after all those hours and stuff?
Yeah, great question. So you do. So every state is different. Most states renew every 2 years. So it means, yeah. So it's a good cost, but it's worth it. Every 2 years, but you don't have to redo your hours.
Oh.
So you're not redoing 3,000 hours every 2 years. What that looks like, is CEs. So you're learning new material, you're attending trainings. It's actually kind of fun in my opinion, because you're keeping up with the times, right? So if new research comes out, you're learning new stuff, et cetera, et cetera. At our practice, we do what's called play therapy. So I also do play therapy with autistic individuals. That also is cool in that you can learn more play therapy techniques and work with kids. We have a playroom and everything. So if you like working with kids, that's a really cool venture. But yeah, great question. You do have to pay every time you renew, but hopefully you're passionate about it, so it doesn't matter. But yeah, great question. Anyone else so far? No? Okay. If you go the PhD route, so the benefit of that is obviously you get a higher pay bracket. It does take longer in school, but you can do more research, right? So if that's your avenue. But in terms of therapy, if you really want to be a therapist, counselors do a lot more therapy one-on-one than psychologists. That tends to be because of the testing. That also tends to be because of the research they perform, etc. So even, I mean, you can still be a therapist and have your clinical doctorate. You get to choose, but that's what my colleagues that are clinical psychologists would say. There's a lot more research and testing if you choose that route. And what I mean by testing is like 3-hour tests with like kids that are having a hard time or adults, can't focus, things like that. What else is on here? I'll do some student questions and then we'll go out to extracurriculars. Let's see. I got one. So does hearing about or helping people with trauma affect my life? Absolutely. Once you hear it, you can't unhear it, right? So it's cool in that I have a lot of openness and perspective and compassion for people and what they go through. But you also have to do a lot of practice of your own. So I go to therapy on my own. I do a lot of self-care just to maintain, because if my cup's not full, how can I be there for my clients? So that's something that you have to keep in mind. Countertransference is another thing where if you're in session a lot and say I have my own trauma and someone talks about something similar, I have to be really trained and mindful not to take on what they're presenting and then take it home. So there's a lot of training emotionally that goes into therapy too, which is cool. And you learn that over time. I also had a question, and I loved this question. How do you approach or work with someone who doesn't want to do talk therapy? Well, if they don't want to do talk therapy, I'm not going to treat them in talk therapy, right? Because at that point, there's no point. However, how could you help them? So many ways. There's lots of therapeutic ventures that you can do that can help someone who maybe isn't ready for talk therapy, or maybe they don't believe in it. Things like horseback riding, art. There's lots of ways, movement, dance, being able to have a support circle, faith, spirituality, lots of things that can be therapeutic and not be psychotherapy, if that makes sense. So that's cool too. Say you still want to help people, you're not sure about the therapy route, you can still make a difference and do therapeutic things without being licensed as a therapist. I'm sure a lot of you see TikToks, Instagram, and they talk about coaching. That is something as a licensed therapist you have to be mindful, because your license is always at stake, right? So if you say something, someone can challenge it, take you to court, so that's something you have to consider as well. But lots of ways to be therapeutic that are not licensed in psychotherapy. Questions on that so far? What are we talking about? Oh yeah, Jake.
So you said countertransference.
Yeah.
Can you explain a little bit more as to what that is and how you avoid it?
Yeah, so great question. Countertransference looks like when, say I had a car accident, right? And I'm going to use an example if that's okay. And you're sharing about your car accident, right? So I start to somatically and mentally experience what you experienced from a level that keeps me from being objective, right? So the danger in that is I'm then activated, I'm then dysregulated, so how am I regulating you? So it happens, and the way to avoid that is continual check-ins with your supervisor. They walk you through it and say, hey, you're really activated by this client, or you're really upset, or you're really reacting, like what's going on? So then you learn to do that. You learn techniques to regulate yourself and model it for your client, right? So we might stop and do a breathing technique. You might think it's for you, but it's really for me, right? So we're doing multi-level regulation techniques that I learned to protect myself, but also to help be present for you. And it also looks like processing it on your own with your supervisor, like I said. Warning signs can be like really activation. You're really upset, you dread going to that client the next day, which I hate to say it, but it does happen. So those are some signs you get taught that you can pick up on, and it's nothing personal, it's more just they're activating something that's creating an emotional response in you. And you have to be cognizant and aware. The other part to being able to challenge transference is awareness. So being a lot of self-reflection, you have to self-reflect a lot. What's going on? What do I think is happening? You also have to be really open. So noticing things, paying attention to things, and that you get a lot of training in graduate school. Hopefully that answered your question. Sometimes it's hard to identify countertransference, so your supervisor might mention it, they might help lead you in that. And sometimes if a client's not a good fit because there's too much transference, can I be unbiased if there's a lot of transference? Probably not, because my activation is high. So, and then you would have to be clinically appropriate in referring out, but that happens less often than it would normally. Any other questions about that? No? Is anyone interested in being a therapist? Yeah, ooh, a lot of hands. Are you guys from Arizona? Most of you? No? Where are you from?
I'm from Ohio.
Ohio?
But I don't know if I would get license there.
In Ohio, yeah. Where else? Are you from here?
I'm from Colorado.
Colorado? I saw more hands, no? Okay. So there is something in the works too, which you should keep an eye out for. It's called the compact license. So a lot of states are working together to try to combine their expectations so that if you have a compact license, you can practice in multiple states, right? So right now, our license is one of the only ones where we have to get licensed in each independent state, which means more fees, which means more expectation. Every state has different expectations. California is one of the highest, hardest. But the compact state, which doesn't include California and Arizona, however, if you're from a different state, it lets you practice in like 20 states. So I would keep an eye on that. That's supposed to roll out in a couple years, at least next year. And that's something that could benefit you guys career-wise too. So I see telehealth, and I also do in person across 2 states, which is really nice. It's a good variety. Yeah.
If you were to do something like, I think it's called like BetterHelp, or like one of the online therapy services, could you meet with somebody in any state, or you would have to meet with somebody in the state that you're licensed in?
Great question. You can only provide services to the state you have a license in. So, and what you have to do is you have to check with each state board before you practice. So for example, if I was licensed in Ohio, in Arizona, if I have both licenses, as long as they're okay with telehealth, providing practices, and someone's not at risk or at harm's way or it's inappropriate for them, then you can practice. You have to hold an active license in the state that they live in, that the client lives in, if that makes sense. Yeah.
That makes sense. So like, say you went to a different state, like you were traveling or something, could you still do the call with somebody in the state that you're licensed in?
Good question. It's gonna depend on your state, which is annoying. The reason being with COVID, right, a lot of different rules were tossed around. They're still figuring out standardization because that presented such a different atmosphere for counseling. Before the COVID situation, not a lot of telehealth was really welcomed and encouraged actually. So that really skyrocketed therapy to allow for more telehealth, to have that more inclusive. So although I want to say depending, yes, but you still have to check with your regulatory board because they have limitations on how long you're gone, if that person can have response to safety, if you can't respond to them, you can't tell someone, you can't go to their house, things like that. So you'd have to assess for safety too. And there's a vacation for each state. They have if they're on vacation, there's a vacation clause, whether they're for it or against it, providing services. But that's a great question. A lot of these things come up when you're practicing, especially telehealth. Yeah.
So like, why do you have to, or why do every single state have different expectations, and why do you have to get licensed
in every state? Why can't it just, cause like, it's all one country, so why is it different?
I don't know, you know, that's what I will say, I don't know. I hope that they standardize it. It's a great question. It definitely makes it important for you to research where you want to go to school, right?
When you did your licenses, what two places you were at, were they similar with how the testing and stuff was?
So to be honest, California has harder requirements than Arizona in terms of licensing. So what that means for my testing, they have a national, it's called the National Counselor Mental Health Exam. California requires that for state licensing, Arizona does not, depending on your license. So those are the type of thing that make it more challenging. The other thing, like different states, California has a higher education requirement in your master's. So the courses that you take and the syllabus that's accepted as a license is going to be looked at. And each state doesn't necessarily have that level of coursework. And I'm not saying there might be other states similar to California. I just don't know. But I would love for it to be universal. Hopefully we can get there one day. But as of now, that's why it's important to research where you want to practice so that you know you don't get an Arizona license and then say, oh, I want to go to California, and then you have to take more classes. So it's beneficial to do your research. Yeah.
Does where you wanna practice, should that determine where you go to college for your master's?
It's a personal choice, right? So if you're choosing your master's based off of where you want to practice, then that would be for your value system, right? Versus you can choose the college based off of the education, based off the community, what's going to be a good fit for you. And then once you're done, you'll have to consider what can I do with this degree and the qualifications I currently have. You can always gain more, right? So you can gain more to meet different requirements. You can take more classes depending on if you move. So it's a lot easier to do that in the long run, but just know that it would require extra work and extra time. So if you've already spent 4 years getting one license, it might seem exhausting if you're not aware that you have to take more classes to get licensed somewhere else. A lot of states have similar requirements, so you're not redoing everything, but it is something that they don't always teach, to be honest, even when you're in grad school. So keeping an eye on like, hey, I might want to have multiple licenses. You can look ahead of time and say, hey, I need these classes. Or hey, like, how would I be able to get these incorporated into my schedule? Sometimes some colleges let you do that too. But yeah, great question. Did that answer it?
Yeah.
Okay. Yeah.
If you wanted to do like the GCU online master's program and you were in like a different state, how would that work with like taking the test to get your license and stuff?
Good question. So what I would imagine, not factual, right? What I would imagine is depending on the state you're applying for, they're gonna look at what courses you took. And I think GCU, so the K-CREP is something that is important to look forward to in master's programs. K-CREP means that it's standardized against the curriculum. So if you're K-CREP accredited, that means that it takes a long time to get accredited. So they spent years assessing the curriculum, they've come and done observations, they've followed strict regimens from down to not leaving class a minute early. If they're K-CREP accredited, that often will help you in being able to apply to different licensing requirements. So back to your question too, if you're K-CREP accredited and you're missing a class, but they're okay with the K-CREP being the accredited part, they might oversee that you're missing a class.
So the ACREP is
Is it good?
like saying that, right?
Yes, K-CREP,
It's applied to the student.
It's applied to the college, the program, yes. Not all colleges, so for example, like SCSU has one for rehabilitation and counseling, they're K-CREP accredited, and you can actually Google who's K-CREP accredited and who's not. And you can see if they're good standing, if they lost it, because sometimes they lose it and they don't tell you. So things to look out for are like K-CREP accredited.
Just to add to that, our next guest speaker is from GCU's graduate program, admissions, and so they'll be able to talk to you about that. I believe most of GCU's is not K-CREP accredited, but they're working on it.
And that's the thing too. So if they're not K-CREP, it doesn't mean that they're not a beneficial college. It doesn't mean that they're not, they don't have the same requirements that will allow you to get licensed. It just means it takes years to get accredited. So they might have all the syllabi that allow you to get licensed, all the classes you need. They might have everything down to the T, and they're just waiting for them to approve it. So don't let that discourage. Just disclaimer. Yeah.
Are you able to get any of your master's school paid for?
Oof, I wish. I'm sure you can. There's creative ways, scholarships, especially if you stay like within network. I would imagine just use scholarship opportunities, teaching opportunities to help with discounts. There are ways within colleges that can offer like staff discounts, things like that. I think it depends on FAFSA, like if you're going to use private school loans or if you're going to try to use, government aid. Sometimes depending on your qualifying status, you can have other grants and things like that. Grants are a good thing to look at, different scholarship opportunities. And then working within the school could also be a benefit as well. Yeah, I wish. I didn't look into that as I should have, yeah.
Did you have a favorite class that you took?
Oh gosh. Honestly, I really liked my degree program. The best thing was we only had 20 students the whole time. So 3 years with 20 students. We were all very close. I think two of my favorite classes were child therapy. So we actually did an internship with Head Start, if you guys know what Head Start is. And we would go do play therapy there, and then we would get graded as how we interacted with them, how we did play therapy. So that was one of my favorites. Another one was we did a trauma class, understanding trauma, which I'm teaching, obviously. I have a passion for it, but I really enjoyed, we had a lot of guest adjuncts from like clinical psychologists, from people who were doing research on trauma, things like that. So those are my favorite classes. But the best part was having a community. You get really close with people you have to sit in class with for hours and hours and share and learn together. So that's a cool part about grad school too. It's very stressful sometimes, but the people you meet can be lifelong friends, which is really rewarding. Honestly, I'm closer with some of my people from grad school than high school friends. So something to consider too in that process. Any other questions so far? This is great. Did you have one? No. Okay. Another question. I still have time, right? Yeah. What is my experience within the workplace? Good question. So I actually didn't start, I've always loved like special needs, developmental disability. I did not start there though. I actually wanted to be a nurse, and then I did research at ASU, and then that quickly changed into psychology. But I actually started at a neurology clinic where I got to work with like OT, PT, speech, language pathologist, neurologist from Harvard. So that was a really cool experience to see how much the world has to offer in terms of behavioral health, in terms of autism, and I totally fell in love with it. So that was what shaped, and I started in behavior. So I actually started with my BSBA track. I started with doing behavior interventionist work. I did that for 3-4 years while I was going to grad school for counseling. And then as I learned more about counseling, there's been a lot more literature on trauma-informed care. I've ventured and specialized in autism, but also with neurodivergency and play therapy, and then in counseling. So that was a journey, but I mean, I've experienced behavioral health in agencies. I've done crisis response, which is so hard, but such a good experience. You learn a lot really fast. Any questions so far? So I do encourage getting a lot of vast experience, whether that's volunteering at different agencies. Agencies are a great place. They can be stressful, but they're a great place to get a lot of experience, to get your toes wet, see if you're interested in what that would look like. Also volunteering, I have a couple opportunities I pulled up that I'll share with you guys. But there's a lot out there, even for like college before you go to graduate school. So there's a lot of opportunities to consider. Yeah?
How did you find like what sector you wanted to focus on? Like when you started your master's program, when you were in undergrad, did you start on the same day, you just continue that pathway, or was it like your internships and all of that when you figured it out?
Good question. Yeah, no, so my experience actually at the neurology clinic informed me of that choice. Initially, I love early childhood. I've always really liked early intervention. I've taught preschool early intervention programs. So that's what I wanted my focus to be. Still love it. However, working at a neurology clinic, that's where I really found the passion to see and to aid in that support. So I really do think internships also shape the populations and the people that you really vibe with. And it can change over the years, right? Yeah.
Do you know what we could do like now to like start building our building up that?
Yeah.
And like what you did like to find like internships possibly when we're doing our bachelor's still?
Great question. This stuff is great. So keep doing this. demonstrating that you have like a passion and commitment for the behavioral health field is great. Letters of recommendation, I cannot stress that enough. So if you don't talk to your professors, go do it, because it's really where they're gonna weigh in. Grades are great, but they wanna know who you are. They wanna know what type of person you are. They wanna know how do you connect with others. So letters of rec are really important as well. Volunteer, so getting in the community, right? So if you're interested, for me, my specialization in neurodiversity, Autism Society is a great one to volunteer with. They have lots of opportunities. Finding internships, there's a few. So you can even honestly Google, because none of you use ChatGPT, right? Oh, Jake, do you mind putting your password in? Yeah. A couple internships I just found for you guys. Impact is one. They work a lot with trauma. They have a lot of like Duolingo too, dual language. So that's a good one they do with undergrads. Gosh, there's, I think Jewish Family Services, Southwest Behavioral Services, all of those agencies need help, and you can get into an internship and practice and see like, hey, do I really like this, do I not? Yeah.
Would those be online or?
I would say that most internships you're gonna find are gonna be in person. Telehealth is really not gonna come until you're already out of grad school. And I could be wrong, but that was my experience at least in terms of like internships and things. What else? Yeah.
This might be silly, but is there any way you can like shadow in on a therapist in any way, or would that be like not allowed?
Not a silly question at all. So you actually shadow sometimes in graduate school. What's required for HIPAA, right, because we have to protect confidentiality, would be that that patient or the patient's parent signs a waiver that says that, hey, you can be observed. What actually happens in Arizona for licensing is you have to be observed for a certain amount of sessions. So some clinics have like a two-way mirror, which is kind of weird but kind of cool. So for sessions like that, they have to approve that you're being supervised, and they have to approve of being observed. So not a silly question. Yeah.
Would you be able to shadow in your undergrad at all, or?
Yeah, I think the shadowing in undergrad would look like connecting with like a therapist or expressing your interest, and they're gonna have to say, hey, I have someone that would be fine, that wouldn't impede their treatment. You could kind of see what it's like. You might not find a lot of therapists that want to do that, just because having one more person in the room is gonna change the dynamic, right? But it's worth a shot, and I can give you more information and do some research too on that.
Thank you.
It is interesting to see, and you can even, like Gary, if you're into play therapy, for example, Gary Landreth has a lot of books. A lot of curriculums use him for play therapy, and he has a lot of videos online about what that looks like, how he practices, things like that. So sometimes you can find that, but I know it's different in person than online. So some of the internship places, I mentioned Impact. Volunteering at like Banner, at PCH, like those are all really good ones. Just to demonstrate your experience. Let's see. Arizona Counseling Association has a whole page for them for people that are not in their master's program yet. That's just the ACA, Arizona Counseling Association. There is a remote I found, so go to remote. The Clinical Behavioral Health Service, there's a job posting for an internship this winter. So don't be shy on Indeed and on those job apps. Sometimes you can find internships that way too, which is cool, just to gain more experience. Yeah, let's see, anything that's gonna demonstrate what you're doing in your community, how you're committed, what you're interested in. They don't want just a paper, right? They want to see like who you are as a person. Why is this important to you? Why do you do it? Now, I can't speak for Ivy Leagues, right? Because I didn't go to an Ivy League. So if that's your trajectory, I would encourage you talking to someone who went to an Ivy League school. But in terms of local or in terms of state schools, really having letters of rec in combination of what you're doing is important. Questions, concerns? Yeah.
Do they at all look at the grades you receive in master's school for your licensure? Like, is it just pass fail, or is it? like
Yeah.
an application or something?
So you do have to prove your transcript that you passed, right? So most graduate programs have a minimum GPA. I don't want to quote this. I believe GCU's does too, right? But for mine, for example, it was 3.5 and up. So you have to maintain a 3.5. If you don't, you go on probation. They work with you, et cetera, et cetera. So typically grades aren't a concern. It's more just, did you get the degree? Can you prove that you passed every class? Because if you don't pass, if you don't have that GPA, then you can't finish your program. Is typically what the response is to grades there. I have not heard of someone getting denied licensure for their grades. So it's more about, yeah.
What kind of assignments did you do in your master's?
Yeah, so we did a lot of case studies. We did a lot of like diagnostic material. We did a lot of assessment, giving and taking. We had to find, like I used my friends' kids to do assessments on, because we specialize in development, right? So we did developmental assessments, a lot of hands-on stuff. You learn a lot in terms of PowerPoints, but it's a lot of being in the playroom with the kids, doing a lot of assessments, practicing diagnostics, getting a case study. And then for like my dissertation, so to speak, we had like a clinical exam that we had to take, and we also had to present a clinical case study of this is what the person had, this is how we addressed it, this is how we treated it, and this is what we would recommend. So a lot of cool stuff. In terms of for kids and family, we did a lot of interventions. So there's like specific intervention classes where they teach you, hey, these are interventions you can do. Sandtray, if you're in my class, you got to see Sandtray a little bit. Sandtray is a cool intervention for trauma where they act out a narrative and they're using sand and manipulatives to express, because we know kids learn best through play. So a lot of hands-on interventions too for adults as well, that we were taught as well. Yeah.
Do you do research in your master's program like you would in like a doctorate, or?
I think it depends on the program, so I would encourage, if you can, do it. If you're interested in it. Some people, it's not their jam. We have research classes I had one in my master's to ensure that we knew and understood the literature, right? That we could interpret it, things like that. I would encourage it, even here, because I know you guys can get involved before you're even in a graduate program. So any experience you have that demonstrates that research will be beneficial, not just to get in, but also for your own educational experience. I used to not love research when I was in undergrad, but I learned to really love it now. So, great question. And then research is endless, so you can continue to learn and grow. Some things I did do in research were things like theory of mind, if you've ever heard of that with toddlers. There's research on like cognitive problem solving with children like 4 to 5 years old, and I helped other people get their dissertations. So that's a benefit too, to see what that process is like. Yeah.
In your master's, do you choose like your do you want to focus on, say like using that to do like neurodivergent reading, but then you find a passion for like trauma victims or something? Do you have to get your master's in that, or how does that work? Or can you switch later on when you're licensed?
Yeah, no, that's a great question. That's all you guys have great questions. So you don't necessarily have to get like a bachelor's and a master's in neurodivergency, right? If you're licensed, your scope is big. And what people do is they go off your experience. So this is what this is why your clinical experience is important. So if you're wanting to pursue neurodivergence, for example, you don't have to be specialized in it, but it benefits you from a pay perspective, from clients. Because if you're looking for a therapist, what are you going to look for? What are you doing? What do you have knowledge in? Like, how do I know you have knowledge in that area? So the cool thing about being a therapist is you can change. So if in 5 years I get a big passion for women's health, I can pursue education, certifications, and then find other colleagues and learn, and then move towards women's health, right? A lot of therapists integrate a lot of specialty, but you don't have to have a specific degree. The only exception is rehab. The rehabilitation is a specific specialty that you'd have to have a certificate for. But a lot of the cool things, once you're licensed, or even when you're getting your licensure, you can do certification programs where you can be an autism specialist, you can be a trauma certified professional, which is what I am. You can be, you can do like ADHD specialty, you can do anxiety specialty. So PESI has great resources if you've never seen it. So there's lots of options, you just need your license. So does that answer your question? Yeah. Thankfully, they don't make you specialize in each area, because if we did that, then our therapists would be so small that we wouldn't be able to serve everybody. Because if one person comes to me who possibly has autism, but also anxiety, right, I would need to know both. So you need to know a big breadth of knowledge, and then you can pick populations you want to specialize in. And that comes after your clinical hours as you gain your licensure. You start to find your niche and what you really enjoy. And it can still change when I have colleagues that have been in practice for 30 years and they've recently changed. So that is the cool part about therapy. Any other questions? Oh, I'm out of breath. Okay. What else? I liked this question. How can we, the audience, recognize that we are the problem and not the other person? That's a cool question. I'm gonna change the language from problem, right? So I understand what the question's asking, but maybe we can replace it with awareness and openness, open-mindedness, right? And I don't mean that in just like a general term, but in terms of if we're from a trauma lens, if we're looking from, hey, I'm gonna be mindful of a trauma perspective, or if I'm looking at a spiritual lens, like I wanna be service-oriented, I wanna give back, I wanna help, right? Having an open mind is what allows us to be trauma-informed, and that allows us to understand other people's struggles a little bit easier. We can't force someone to be self-reflective, right? But we can hope and pray and encourage them to engage in that way. Yeah.
Did you find, I don't know if I'm gonna be able to articulate this, but did you find that when you started working, that were you ever like shocked by a patient being like unresponsive to your therapy, or like unwilling to participate? Like, did you feel like you had a naive perspective of that, or did school prepare you for that?
So school prepares you for a lot, but they cannot prepare you for everything. So yes and yes. In our schooling, we had what's called reflective supervision. So you meet in a group and you process together. You share, because everyone has signed documents, everyone's aware, HIPAA, so you share and you process together. And then there's a facilitator that teaches you, hey, you guys are sharing a lot, you guys have similar things. So that's one way that you learn to train that. And another way is you're still shocked and you have to keep going to colleagues. I even call colleagues sometimes and I'm like, hey, this case is really hard. Like, what do you think? I think that's one of the hardest things about being a therapist is you're not actually a fixer. You're helping them work towards their goals for themselves. Yeah.
Is there ever a time where you, for lack of a better term, have to give up on someone?
I see what you're saying. Give up, we'll replace with like find the most supportive treatment. And sometimes you're not a good fit. Like you and the client you're not seeing progress. And is there harm to continuing them if that's happening? Yes. Yeah.
This might be a weird question, but is there like an industry standard for like the amount of clients you can see at once for your personal and like mental health as well? Because you deal with a lot of stuff.
Yeah, no, that's also a great question. Industry standard, no, it's not really standardized. My personal experience, I've been places that typically 30 is the average in an agency, right? Benefits of private practice, you have more control, more choices that can limit that caseload. So it is a lot, and so that's one of the things, if you see job postings, if you see internship, they might comment on, hey, lower caseloads, more case management. That means they're trying to reduce the amount of people you have, but they're trying to increase the amount of coordination you're doing, like for doctors, for other school counselors, to make sure they're getting care. But yeah, so it can be pretty high. So as you go through your career, you have to learn how to navigate, hey, I can really do this, or I might want to take a less formal industry, if that makes sense. Yeah.
When you're saying a side that takes typically 8 years, is that including practice or not?
It's not, and it doesn't have to take 8 years, but I mean,
Yeah, I was thinking that it's typically around 5.
yes, so where it gets sticky with the PsyD is, I mean, not sticky, it's great, but so PsyD you're gonna have to do at least 3 years, 2 to 3 years of coursework, right? You're also gonna have to do, depending on what state require postdoctorate. So even if you finish school in 3 to 4 years, depending on the state you want to be licensed in, you have to do 2 more years of postdoctorate work. So that's high, but that's why there's private practice. There's also agencies that do really well not doing high caseloads. That's why there's supervisors who support people with caseloads. I will say advocating for yourself is something you learn in graduate school, but it is a field where a lot of people tend to be more self-aware than others, hopefully. But yeah, did that answer your caseload question? Yes. And that's not everyone. So some might have 20, some might have 15. Crisis typically has less because they're more inclusive, or more intense, I should say.
You mentioned having a client or like a case of like that you don't have enough yet, you go and ask one of your colleagues. How does that work with like the boundaries or like whatever it is? Yeah, with the web, like in speaking about their case, like can you actually go into detail or like how do you do that?
Yes. No, that's fantastic. So with HIPAA, we cannot identify their identity, right? So if you're in a consult group, which is typically what happens when you're licensed, you can find colleagues or people that you've worked with prior or old supervisors. You cannot disclose 3 identifying factors, right? You can't disclose their name, can't disclose their age, can't disclose their birth, anything like that. So it's a vague case study, for example. Hey, I have someone that is presenting with XYZ symptoms. This has been the course of treatment in this case, or have you seen this before? What do you think could be a support, or what would that look like? So you're never identifying the client, you're only asking from a clinical intervention perspective and a diagnostic perspective, yeah. Which is typically how those consult groups work. And you get really used to not divulging any information. You're like a vault and the keys gone. Who knows when you would break confidentiality? If you're in my class, you should know this. Yeah.
In a crisis,
Crisis in what way?
like if you need to send emergency services or something.
True, like if they're in harm, if they're in harm's way, yeah.
If they're a danger to themselves or to others.
Yes, great. Do you have one more? Yeah, she's slurs. If they report abuse, right? So if they report, which is danger to themselves or others, right? But if they report, that would be when you break confidentiality. We're talking about class, so I nerded out for a second. But yeah, so great question about HIPAA. You still always have to maintain it. And there's actually year requirements. So you have to keep files in each state for a certain amount of years. So I have to keep records of all my stuff for each client for a certain amount of years, depending on since when they turn 18. I think Arizona is around, I don't want to quote it, 7 to more years you have to maintain records for, because you can get subpoenaed at any time. But that sounds scary, and we don't need it to sound scary. Yeah.
What was your work-life balance while you were in grad school, and what's it like now?
Definitely better now. In graduate school, I do not recommend working full-time, although I understand you may need to for financial reasons. It's a lot. It's like a degree program and a half, basically. So if you're going to work, I would definitely do something that's not emotionally taxing to the extent that your degree program will be. You'll spend a lot of long nights studying, and you can do it with time management, but it's like really important to know when to ask for support, when to take a break, when to keep your exercise going, keep your health going. Because if you're stressed out to the point where you can't serve yourself, like I said earlier, you can't really serve anyone else. And that's not selfishness, right? Like in grad school, we were talking more about how do I balance to maintain and be able to pursue and continue this journey. Yeah.
Is there any like different look on online versus in-person grad school in like the field?
I will say online is more common and more popular now than maybe it was when I went to school. I'm not that old, but it sounds old. The difference may be if you thrive in an in-person environment and hearing it, seeing it, engaging with others in discussion, that's gonna look different than online. However, online, there's no detriment to doing it online. It more is so, what's your learning style and what do you need flexibility-wise? Do you want to come to class every day? Is that something that's gonna help your routine, or can you do activities online? Sometimes that might mean more activities online, right, to help you demonstrate the understanding. But you don't, one is not better than the other, it's more so what's a better fit for you, if that makes sense. This is fun. Should do this. Okay. Any other just questions that have come up? I'm not gonna make you look. covered a lot. Let's see. Yeah. If you really want a high-paying job with therapy, it takes a longer time to get there. Just being honest. So if that's what you're in for, just know it takes a while. Yeah.
What practice, where did you go to that?
Yeah. I went to San Diego State University. I really enjoyed that program. And they have a program still, so little shout out to them. Any other questions? Yeah.
When entering the workplace, did you find that it was competitive enough in that the prestige of your school mattered?
My experience, no. Depending on where you're applying, I don't want to say it doesn't matter because I couldn't speak for them, but if your resume is solid, if you have good grades, if you do well on your essays, and you do well in your interview, I'm not going to say that the school is going to take away from all of that. That makes sense. Hopefully a good program would be able to assess for that. Yeah.
What do the interviews look like for grad school applications?
Yeah, great question. So mine was a two-part process. I actually I did a certificate program first, and then I did the additional graduate, so it was a graduate certificate and then a graduate program. But it required an application online. I had to submit everything. Then they told me, hey, we want to interview you. So then I went and I did a telehealth interview. And they said, okay, you're good to go for the second process. Then I actually had to go in person and drive out, which who doesn't love San Diego? I mean, biased, but, and then I actually had to interview in person. And then from there, they let you know, hey, you've made it, or hey, try again. And I don't know if everyone's is quite that same, but I do think there's often a 2-interview process.
Okay,
for
yeah,
most
I
schools.
am applying to SDSU
Oh, yeah.
specifically,
Oh,
and
cool,
other
okay.
schools too. But
Yeah. Talk to me after class. I might have a resource for you.
Thank you.
Yeah. Any other questions? Is anyone? Oh yeah. Go ahead. Most grad programs. Now that there's online ones, you might find more flexibility in that. They might start like summer. They might have different terms. Mine personally was in fall. Tend to see a lot start in the school year, but if you find it online and you like online, that might give you more space. And hopefully, yeah, when they come for GCU, they might be able to answer from their experience as that role of more information on that. But yeah. Anything else? No? All right, well, that's all I have for you. Last chance for questions. You guys are probably tired. Cool. Well, if you have questions you don't want to say out loud, you can talk to me. I'll stay for a little bit and you can ask me questions. But it was great speaking. Thank you. Feel free to email me if you want. I'll give Jake and the officers my number or my email so you can email, you can reach out. I'm happy to support you guys.
Thank you.